Yeah, Cynthia's also there. She just doesn't have her video on yet.
No, I can't, it keeps turning off, but am I on yet?
No.
We can hear you, we just can't see you. Oh,
Yeah, you're on. You were on for a minute,
Yeah,
Cynthia.
This thing turns off and on. Okay, go ahead.
Yeah. Okay.
A few minutes ahead.
I can see you now, Cynthia.
Okay.
We have 3 more minutes and then I can start. It'll be 5:30 in 3 minutes.
I didn't go all the way through the packet. I'm having trouble opening it at the same time that this is on. Are there any motions for this meeting or not?
No motions were sent out for this evening.
Okay, thank you.
Members, we have a toll-free video conference and telephone. Members of the public may access the audio feed of a meeting by dialing in using the numbers that were provided. We have a quorum of the board in attendance via our video conference link. I would like to call to order this emergency meeting of the Central Health Board of Managers. For the members of the public joining in us this evening, I should note that technical and security issues with the video conferencing platform for these meetings has caused us to limit public participation to audio only. We are working with our video conferencing vendor and hope to have these issues corrected for future meetings, which would then allow the public to participate via video. The recorded audio and video stream from this meeting will be posted on the Central Health website as soon as possible after the meeting. The first item of business is public communication. Yvonne Davila of the Central Health Communication Department will briefly cover the guidelines for public comment for the meeting and will then introduce all commenters by name and invite them to speak in turn. Yvonne?
Thank you, Madam Chair. My name is Yvonne Davila, Director of Communications at Central Health. In order to be recognized to speak, you must request a speaking slot using our online form or by leaving a voicemail by 4 p.m. the day of the meeting. All speakers will be recognized by name and in the order their speaking request was received. Please keep your phone muted until you are called on to speak. Please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes, and staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Once again, speakers will be muted at 3.5 minutes to ensure the efficiency of this meeting. Speakers may not donate their time to other speakers. As a courtesy to others and to be respectful of time constraints, please try not to repeat other speakers' comments. Depending on the number of speakers and the total time being spent in public communication, the board chair may, in her discretion, impose additional limits on time or comments. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. With that, I will call the first speaker. Her name is Deborah Price. Deborah, will you please unmute your line? Ms. Price, will you please mute your line? I believe you have to press *69 to mute your line. Unmute your line. Ms. Price, please press *6 to unmute your line.
Counselor, may I suggest something, and Madam Chair?
Yes, Mr. Giesel.
If individuals are having technical issues, we can always come back.
Yes.
List.
I agree. Maybe somebody could text or call her offline and we could move to the next speaker and then come back to her. What do we think about that?
That sounds fine. One thing to note is that when speakers had the opportunity to decide to let us know their preferred language, and no speaker who signed up used another language other than English. Otherwise, we would allow for translation. The next speaker that signed up to speak is Mr. William Buster. Mr. William Buster, will you please unmute your line? You can press *6.
This is William Buster. I did not realize, my staff did that for me. I did not realize that they were signing me up to speak. I have no questions for the board. Thank you.
Okay. Thank you, Mr. Buster. The next speaker is Ms. Malia Odell with the Hornsby Bend Austin's Colony Neighborhood Association. Ms. Odell?
Oh. Hello, this is Malia Odell. I haven't seen the agenda, but I'm present and I don't have any questions. Hello?
Okay, thank you, Ms. Odell. Thank you so much. Thanks for being here.
You're welcome.
This concludes the public communication, unless Ms. Deborah Price can unmute her line. Ms. Price? Madam Chair?
Are we ready to proceed?
Yes, this concludes public communication portion of the meeting. Thank you, Madam
very
Chair.
much. Thank you very much. Members, before we start the agenda, and I want to thank those who participated in our public communication. And I know there was one individual who may have had trouble with the technology. So if Ms. Price is able to talk and wants to, we'll come back to her. But before we start the agenda, I want to thank you, members. I know that we are in new territory. We are in the midst of an unimaginable public health crisis, and our community's response continues to inspire me. I want to thank all of you, my colleagues on the board, for your tireless efforts and for your willingness to participate in this emergency board meeting on such short notice. Thank you so much. Recent reports in other areas of the United States indicate that people of color, specifically African Americans and Hispanics, are disproportionately impacted by COVID-19. We must continue addressing health and equity disparities in our community, particularly among people of color in Eastern Travis County. These are the people Central Health is most committed to serving, especially in these times of great need. This evening, we will discuss the board's continued strategic direction as we navigate this pandemic. Additionally, we will receive updates on clinic operations, testing and screening for at-risk populations, and communications efforts. The Central Health Board will continue supporting our healthcare partners, and we are grateful for the amazing commitment and service of our affiliate, Community Care. Thank you for being on the front line. We could not do any of this without our dedicated, passionate staff, and thank you to all those who are present and who are not. Thank you so much for your dedication. And of course, the more than 100 care partners, including Travis County, the City of Austin, and UT Dell Medical School, been very instrumental in all kinds of modeling and data. We want the people Central Health serves and our entire community to know we are here for you. As we have for more than 15 years, we remain committed to serving as Travis County's healthcare safety net, more so now than ever. I want to turn our attention to the agenda now. Number 1, receive reports, discuss, and take possible action on Central Health and Community Care's responses to address the impacts of COVID-19, including the following topics. A, the objectives governing Central Health's responsible response activities. B, current and future status of clinic operations. C, plans for increasing screening and testing for at-risk populations, including communities of color. And D, communications and outreach efforts and resources. I will take up, and we will take up as a board, each sub-item which will be presented separately. Board members, I ask that you please allow each presenter to complete their presentations and that we complete all of the sub-items before asking questions. I think this will be easier given the technology. Mike Giesland will begin with an overview before we take up each sub-item. Mr. Giesland?
Yes, thank you, Madam Chair. Members, in lieu of an email update this week, we're providing the Board of Managers with this verbal and visible presentation this evening. This information is operational, and specifically it outlines how we are serving historically under-resourced communities, including supporting Community Care and Senderos as our partners in health equity. We will have limited fiscal information this evening. We'll mention it in spots, but we do plan on a more thorough discussion at next week's regularly scheduled board meeting regarding any fiscal or financial information that affects Central Health and its enterprise colleagues in response to the COVID pandemic. First, as a backdrop, I'll provide quick context of Central Health's role in this pandemic response, and I'll refer to an excerpt from the board update that was emailed on 9 April. And specifically, Central Health is operating under a business continuity.
Mr. Giesland, I think I should probably at this point read that we are addressing A, the objectives governing Central Health's response activities, and that Mike Giesland and Monica Crowley will be presenting.
Thank you. So Central Health is operating under a business continuity plan, which covers restoration timeframes for critical functions. That is, what needs to come online and by when during times of a business disruption. It also includes how long we'll continue in a disrupted environment. And a pandemic with local isolation orders is a business disruption. More specifically, our business continuity plan maps out how we'll continue to provide shared operations in support of community care in Sendero. This includes technology, facilities maintenance and management, and human resources. How we process financial and procurement transactions. We provide government relations support and monitor public policy responses to the pandemic. We perform the enrollment, care coordination, and daily management functions for the medical access programs. This includes MAP and MAP Basic, which is our sliding fee scale program. It discusses how we'll provide comprehensive community outreach and education across all mediums and cultures. And this is boosting communications and outreach in unprecedented ways. We'll continue the work on board designated priorities for fiscal year 2020. While what I've just named sounds like very familiar operations of a healthcare district, what is new is that we're engaged in a locally coordinated effort through the Emergency Operations Center. And like the rest of the community, our work is influenced by the orders issued by the judge and the mayor, as well as state or federal orders or guidelines. And it is important to understand that a pandemic response is a national, state, and local public health response. And while hospital districts across the state are part of these efforts, they are not the lead agencies in their local environments. In past support roles, such as the one that we provided in the response to Hurricane Harvey, we learned that it made more sense to have community care take the chair at the operations center because the focus is on direct care operations and community care as a frontline operator. And in this spirit, Central Health is supporting community care as the conduit into the local operations efforts. Continuing with the Emergency Operations Center, coordinated disaster response requires a very intense dedication of resources, and Central Health is either contributing direct staff involvement, or we are actively monitoring several task forces under the local response command. And these include the alternative care sites, mass casualties, contact tracing, and social services. And within these local structures, we are cautious not to duplicate work that would otherwise dilute efforts to help those that we serve. For example, standing up programs that the city or county is already staffing. And at this point, I'd like to provide a public commendation to Austin Public Health and just the immense amount of work that they've taken on and everything that they're doing to serve disadvantaged communities and lead in these efforts. Lastly, we're using the Emergency Operations Center seats that we have through community care to request better demographic data, including demographic for hospitalizations, and advocate for support of primary care and better public awareness. Now, this provisional management team that is organizing all of the internal operations efforts, but also working to contribute externally through the local operations efforts, is a management team that is comprised of executives and subject matter experts. And Megan Cermak is acting as the project manager. And we're fortunate to have staff within Central Health, as well as in our enterprise partners, Community Care and Sendero, that have been part of prior disaster and emergency response efforts and professional careers. I think this past experience is really proving to be valuable to the enterprise. Megan, have I missed any details regarding the Emergency Operations Center or the public health response that I need to cover before I close my remarks on the presentation?
I have not.
Okay. So, looking forward, before I hand it off, it remains to be seen what Travis County's post-peak experience will be like and whether vaccines or therapies will ultimately tame COVID sooner rather than later. But what I am confident of is that everything will be different from this point going forward. And some of the lessons learned are that we'll need to disaster-proof our delivery of healthcare. And I want to commend community care for pivoting very quickly to make sure that we're able to continue to provide care in probably what is the most challenging of environments. Another lesson learned is that we need to be nimble and flexible, and we don't need to duplicate what others are doing or, quite frankly, can do better. And as this pandemic has laid bare why public and community health is so important, and how it is so important that we address historic disparities and current disparities. We all need to take ownership of this moment and respond with decisiveness, but be ready to move forward to a new beginning. At this time, I'll hand it off to Monica, who will elaborate on how the board established a strategic direction for its bylaws and aligns with our budget. And hopefully this will inform your deliberations this evening. Thank you.
Thank you, Mike. And I am going to share my screen. One moment. Come on, let me try this one more time. Okay. Getting. Shoot. So is that sharing? Can you guys all see the strategic plan objectives? Thank you.
Yes, thank you.
Sorry about that. Thank you, Mike. During this part of the presentation, I'm going to review, like Mike said, the current board strategic plan that we are operating under and the current budget priorities. Look at a high level at some of the learnings from our immediate COVID BCP, business continuity plan response. And we are going to make a recommendation about discussions about whether we can continue to work and plan under our current strategic objectives and priorities, or whether we need more specific emergency objectives or new objectives moving forward. Currently, the board has provided guidance to our CEO and staff through its fiscal year 2019 through fiscal year 2024 board adopted strategic plan, and through the annual strategic priorities adopted through our fiscal year 2020 budget resolution. And these objectives are to develop and execute a healthcare delivery strategy based on people in place, to implement patient-focused and coordinated healthcare system, and to implement a sustainable financial model for healthcare delivery and system strategies through fiscal year 2024. The current budget resolution priorities include priorities towards improving our healthcare infrastructure through our Eastern Travis County expansion, and through technology enhancement, particularly through supporting the Epic electronic health record implementation, through our Central Health Premium Assistance Program expansion, where we moved more complex MAP patients into the Sendero Health Plan product, through increasing access to care by looking at extending the eligibility period for our medical access program from 6 months to 12 months, and primary and specialty care project-based enhancements that have been ongoing, through exploring sustainable funding models, particularly through our healthcare partnership, through continuing to work on the development of our Brackenridge campus property, and by making sure that we are maintaining appropriate levels of financial reserves. Now, these priorities and objectives, of course, like Mike said, reflect our pre-COVID-19 world. And Mike did describe during his comments how Central Health and our enterprise partners and community care have quickly adapted to the pandemic and this is operating under our current objectives through this business continuity plan. As we're moving into this next phase of the COVID response and the next phase of our business continuity plan, we continue to learn through these operational shifts. Some of the learnings that we've gained during this initial phase include things that we've learned by moving to work at home as much as possible, and still be able to continue to support Austin Public Health and the Emergency Operations Command in these community-wide responses that Mike discussed during his comments, and Joint Tech and our eligibility team and our other teams have been able to continue to provide operational support across the enterprise. In our eligibility and enrollment functions, we've adapted our procedures to enroll people safely in MAP and MAP Basic without having face-to-face appointments and ensuring continued coverage. We've expanded and developed new modes of communication with our community and community stakeholders, and we're continuing to work on that. And we also are supporting our contracted providers, and particularly providing support to community care as they move to telemedicine to meet patient needs and ensure ongoing access to care and address this COVID-19 response. And we've had to make these changes, incredibly quickly over the past month. And what I know, as everyone says, particularly this move to virtual eligibility and telemedicine has truly been amazing. And these responses have been based not only on CDC guidelines and wanting to protect providers and staff, but based on provider guidelines to ensure that patients are able to get the care that they need by mixing virtual care and in-person care, so that we can reduce the exposures that people have to the healthcare system in person. And COVID-19 is really speeding up changes that have been happening across the system that in some ways are going to make care more convenient and provide some access to care to providers that can be much more quickly, that can happen more quickly than if you have to call and schedule a face-to-face appointment and determine what your transportation needs are and get in. We don't know how long we are going to be in this COVID-19 environment, but what we have heard from providers is that we are probably never going to be going back to the world as it was before COVID-19, and that we are going to be the new care modalities and pathways as we provide care are going to be forever changed. And we are continuing to make sure. We don't know how these new modalities are going to be implemented over the long term, but we do know that the EPIC implementation is going to bring additional functional capability, and this is going to remain a priority. And that, we believe that there may be some opportunities to increase our access to care more quickly and efficiently. And we're going to need to continue working to expand our online eligibility and enrollment processes and our work towards bringing in-house our own call center functions for eligibility and enrollment. And as, kind of the planning and exploration in these areas is continuing, we also need to reach out to our patients and people that are being served to gather data. We've heard anecdotally from community care, and I know Jason's going to present in a minute, But we've heard anecdotally that the telephonic visits are going well for patients and providers, but we're working on steps to reach out directly to patients through surveys to gather that, gather their experience firsthand so that we can report that back to you and, use that in our further planning efforts. Determining priorities and objectives as we move forward is going to require consideration and discussion from the board. And we're recommending that a full discussion that includes immediate potential responses and planning efforts for next year in light of the pandemic take place in the strategic planning committee. We have been operating under the current objectives in the business continuity plan, but the board may adopt an emergency response objectives or objectives in the immediate term. We also need to evaluate how COVID-19 and the current pandemic may impact our current strategic plan and priority objective, with such considerations like whether the Brackenridge campus redevelopment timeline could be impacted by social distancing requirements or a broader economic turndown. If there's going to be an impact on the EPIC implementation, which we know is going to be even more imperative for us to complete successfully the goals for this year and the next related to that. And then looking at how we manage demand for services and mitigate the impact both of increased needs for services, but also decreased utilization of services and impacts that could be negative on our provider partners. How can we be supportive in balancing those issues? And then how do we plan to address gaps in this new COVID environment? And can we utilize these learnings to more effectively fill gaps and address needs in our community, in communities like Eastern Travis County that are longstanding gaps that we've been working to address? Can we use some of the learnings from COVID-19 to move that work forward in the coming year? And some of the discussions that we need for you to have and direct us on are, do we need to revisit our fiscal year 19 through fiscal year 24 strategic plan and objective, or can we continue to respond to the epidemic and then plan for fiscal year 21 our strategic and budget priorities under the current strategic plan objectives? And we're recommending that those discussions happen in the strategic planning committee. And that's all from me.
Madam Chair, that concludes our presentation under subtopic A.
Thank you. We'll now move to subtopic B, current and future status of clinic operations. Dr. Jason Fournier of Community Care will be presenting. Thank you very much for being here. I know how exhausted you must be.
So much, Chairperson Greenberg, and good evening, Board of Managers of Central Health and guests on the phone, including those that might be joining virtually as well. I'm just going to share my screen right now. And can you see my screen, Manager Greenberg? Yes, terrific. I also want to acknowledge that joining me this evening, Community Care, as the Board of Managers knows, is Central Health's partner in operating the health centers here within Travis County. And joining me this evening are representatives from our Community Health Center Board of Directors, Community Care's Board of Directors as a 501c3, and as a Health Center Board is our Board Chairperson, Dr. Tom Coopwood, our Vice Chairperson, Pilar Sanchez, our Treasurer, Christopher Rios, as well as our Secretary, Guy Swenson. And I know they're going to add some commentary after I actually go ahead and present to you this evening.
Thank you for taking the time to be here. We greatly appreciate it.
Yeah, I'm more than happy to be in. I know they are as well. They're looking forward to the engagement this evening. Actually, I'm looking at a staff presentation for tomorrow. So I'm going to stop and I'm going to switch over to a different chair. I apologize. I had that one pulled up.
While you're doing that, I do want to give a special thanks to the community care board members who are here with us, either on the phone or on the screen with us this evening. Thank you so much for being here and all that you have been doing. We are so deeply grateful to you.
Thank you so much for that, Manager Greenberg. So you should be seeing the correct slides now. I apologize for that technical issue. So it's our pleasure this evening to provide a brief update on some of the responses that we have of late. I know we were afforded the opportunity, I believe last week or perhaps the week before, because it's all blending as it relates to, and it's hard to believe that we're only 4 weeks into this. As I talk with staff, it truly does feel like we've been at this for months, and it's quite remarkable how well our staff are responding and their dedication to their community. As we talked last time, this is all about team, and the team at Community Care has responded very well, as has our partners at Central Health. We can't do this without your support. We also are partnering with APH and other healthcare providers in the community, participating, as Mr. Gieselin indicated, within the Emergency Operations Center. So it really is a community-wide effort, but we're focused, as always, on making sure that folks within Travis County and the surrounding communities for community care at large, who are under-resourced, who have low incomes, who are uninsured, underinsured, have access to the services they need and deserve. And today it's even more important than ever before because of the coronavirus pandemic and the disparate impact that it's having across the country on the communities that we very well serve. We know on a day-by-day basis, regardless of what time of year it is, the patients that we serve, the communities we serve, are at greater risk because of persistent health inequities for an adverse outcome. And that's amplified when we're facing a public health crisis, as you so eloquently indicated at the beginning, Manager Greenberg, as it relates to this public health crisis. And we're very privileged to not only continue the services that we provide to the community day in and day out, but also to be part of an overall response to protect their health and to partner with the patients and communities we serve. And so I want to provide an update relative to our testing initiative. As you as board members are fully aware of, I think the first topic, I think the second topic, I may be ahead of myself, is actually taking a look at clinics, correct?
Yeah,
so you're on mute, Sherry.
Let me announce both of them. We will be taking up current and future status of clinic operations, which is B, and also C, discuss plans for increasing screening and testing for at-risk populations, including communities of color. So I think that will allow you to cover both of these as you see fit.
Thank you so much, Manager Greenberg. So with that stated, I'm going to start with the testing initiatives. So I think as the Board of Managers is fully apprised and aware, in mid-March, on March 17th, we actually stood up the community's first open testing center at our Hancock Health Center. Why I say open is because we allowed anyone from within the community, inclusive of our patients, but beyond just our patients, to be able to seek testing at that site. The other thing that was unique and still remains quite unique is we didn't require that an individual had been referred by a clinician and assessed by a clinician. Although we did open up a hotline at the same time and asked folks to call that hotline, and most of the referrals that ended up going down to our Hancock drive-thru testing center have been through our hotline. Certainly community members at large have found their way, just given its proximity to a very large HEB and proximity to I-35. When we take a look at the activity through that site, we've seen almost 2,000 unique individuals come through that Hancock site through yesterday. We don't have the numbers yet for today. They're going to hit my inbox sometime this evening, and we'll update our stats. Of that, not everyone is deemed of having to be needed or to be screened and or tested. And so some of the folks that are coming through the drive-through testing site that we're operating at Hancock actually come in just for general information. And we happily provide that to them, our teams do. Coupled to that, what we then do is we screen individuals through a nurse triage and a clinician. And out of the individuals that presented, almost 2,000, almost 1,500 were screened and progressed forward within the drive-through. Of those 1,500, we've tested as of yesterday afternoon through that drive-through testing site, almost 1,150 unique individuals. And you can see the stats, and it varies depending on the days, but we're monitoring it. Last Friday was by far our busiest days down at that site. Earlier on, we had very limited tests that were available, and so we weren't able to do as much testing. We still struggle to go ahead and make sure we have enough tests. For example, on Saturday, we almost had to close down our Hancock drive-through testing site because we were running out of tests. Fortunately, we had another supplier who was able to step up. And then this week, as we're looking and have actually initiated additional testing, we've been able to secure some tests. But that still remains an issue for us at Community Care as we're looking at the continuance of the Hancock testing, as well as going ahead and moving forward with additional testing sites. I'd be remiss in not pointing out that we here at Community Care are going ahead and also testing within our clinics. Our preference is, of course, to try to get folks to our testing site where the staff is very skilled and able to do that. And also, if someone's presenting with respiratory illness, we're following the CDC guidelines to go ahead and screen them in a very specific site. But our clinics are testing. To give you a little bit of example of the testing as a whole, we have about another 400, 500 individuals who've been tested through our clinics. When we take a look at our positivity rate, we're sitting at 184 of our patients have come back positive. There's still some test results that are pending with the labs, and they average between anywhere from 24 hours to 5 days in processing right now, which is much better than what I reported a week or so ago when we initially were looking at 10+ days when the tests were being sent out to California through our reference lab. All of that stated, our positivity rate right now, so for the test results that we've conducted, or the tests we've conducted for which test results have been returned, we have a positivity rate just less than 15%, which means that our tests are being used very effectively. And it also means that folks who need to be tested are reaching out and getting tested within our environment. Speaking of vulnerable populations and populations that need to have additional testing, in cooperation with UT Health Austin, last week we conducted quite a few tests through the Salvation Army. On Wednesday of last week, one of our clinicians who was rotating through that site actually saw someone who had corona-like symptoms, or coronavirus-like symptoms. That individual was tested. The test came back positive. The next day, with the help of UT Dell Medical School, who was able to provide testing kits for us, we actually our team screened 79 individuals at the Salvation Army. Right now, the amount of positives that have come back from that are in the high teens. My CMO thought it was 19 earlier today when I talked with them, but he needed to verify that. We also tested additional individuals through the ARCH on Monday. And so we rapidly responded to the potential of cluster or a clustering of cases very quickly. And I think it shows the value of partnerships within the community that are occurring and have been in place, but really are being fostered and really being brought to bear as part of the response in targeted efforts when they're needed, because part of our containment mitigation will be going ahead and when clusters arise that we're responding very quickly. So also speaking of testing, It's critically important for us here at Community Care, for you as the Board of Managers, and for the staff at Central Health, for us also to be targeting our testing towards communities that are more geographically isolated within Travis County. And to that end, and based on feedback both from Central Health staff, from you as Board as Managers, from our own Board of Directors here at Community Care, coupled to feedback from the community, as well as aligned with what we want to be doing within the community, we've been able to go ahead and look to expand our testing initiative into harder to reach areas within Eastern Travis County, sometimes referred to as the Eastern Crescent, as coined by the city demographer in 2015. And so thanks to our ability to secure additional testing sites and personal protective equipment, both through Austin Public Health and through some of our own suppliers, we're able to go ahead and initiate additional testing sites. What we've set up, and it's actually started today, and so very proud to report to the Board of Managers and to the community members who are on the phone and others on the phone, that we stood up an additional testing site in Del Valley through the Southeast Metropolitan Park. Travis County was terrific in allowing us to do that, had to execute a quick agreement with them, very easy to work with, again, demonstrating the community collaboration partnership and trying to get things where they need to be in resources. We actually screened 20 individuals at that site today, 10 of which were tested. And that was with very little notice going out into the community that this was being stood up. We'll be back to Del Valley next week at that location again on Thursday. And what we've set up is a team that's using our collective mobile medical unit, the Central Health Community Care Mobile Medical Unit that has exam rooms. It's going out to there. We're popping up tents. No one's going into the vehicle, but we have to have on-site refrigeration to be able to store and appropriately have the testing media that we need to be able to conduct these tests. That team is going to be rotating at multiple sites. Earlier today, Austin Intermediate School District, again, another key partner, is providing us permission to be able to use Barbara Jordan Middle School in Colony Park to initiate testing. And we are going to be testing tomorrow morning in Colony Park at Barbara Jordan Middle School. So we're very thankful to them for that as well. We also received confirmation that Austin's Colony Hornsby Bend HOA is giving us permission to use their site. And so early next week, and I think that's on Tuesday, we'll start initiating tests there. We're also looking at William Cannon on Monday outside our clinic doing something for the Dove Springs community. And then on Wednesday, we're working with Manor ISD right now, and they've already given us a verbal. We're just finalizing that, and we're looking to test next Wednesday at Manor ISD so that you and your peer board members know, Manager Greenberg, Chairperson Greenberg, is that these sites are going to be consistent week after week at the same locations. Our intention is to continue to provide testing so long as we have adequate testing materials and PPE, which we're hopeful will go ahead and continue. If we run short, we'll be very deliberate about making sure we let the community know that there's got to be a temporary pause for a day or two while we're securing more resources, but very hopeful that doesn't come to pass. Additional to that.
Thank you so much. We appreciate that.
Yeah, and more than happy to do that. And I think the other part is that if we see that there's a significant demand through one of the sites, then we'll look at ways for us to increase testing within the community, again, mindful that those resources are needed. And then I also have our rapid response team. We stood up a rapid response team in mid-February to plan for our coronavirus pandemic response. Of course, it was a pandemic at that point in time. We have them right now planning for what testing in Pflugerville could look like, either directly through our health center in Pflugerville and or in conjunction with a facility yet to be identified. So that Pflugerville is definitely on our radar screen. So all of these sites should be online within the next week, with perhaps the exception of Pflugerville perhaps coming on the following week. But we do have our Pflugerville Health Center up and running. We can see patients there. We just ask that they call our hotline so that we can triage them appropriately and then prepare the staff to go. So that's our expanding testing relative to additional testing sites. The other thing that I'm very pleased to report to the Board of Managers, and as you know, several weeks ago on March 23rd, and we provided notice prior the week before, but on March 23rd, we had to make the very, very difficult decision to close some of our smaller single provider sites. And there were multiple factors that came into play with that. But first and foremost was the need to safeguard the health of our patients and of our staff. On March 23rd, we were looking at our services as they existed at that point in time, considered a reduction. We didn't know how much we were going to reduce. And we were looking at personal protective equipment that was extremely hard to get our hands on. And so in order to conserve our personal protective equipment, we made a very difficult decision to go ahead and consolidate those resources into our larger sites, partly because we needed to pre-screen folks before they entered in the clinic. And in so doing, we were using personal protective equipment for less patients as they were going into the smaller sites. The other reason behind it is if we did have someone with respiratory illness, when we worked them up further within the clinic, we effectively shut down the clinic because they're so small, because the air exchange turns over the air in a very small space. But coupled to that, based on CDC guidelines and OSHA guidelines, we needed to shut down the exam room for at least 50 minutes. And so it was making it very difficult. As we're moving forward, the other part is we were also had put into place conservation methods with our staff. In terms of how they use PPE. So typically a staff member would don their personal protective equipment, and once they were done with the patient, they would take off their gown, their face shield, their mask, their N95, and that would be just trashed. Now what we're doing is, unless there's a direct exposure, they keep that equipment on. The N95s are used until the seal breaks down, and so that's extending the life of what we're able to use. So that's taking the average mask that's being used to 3 to 5 days, and it's safely used, and we're supporting our staff, but we've been able to conserve our PPE that way. Additional to that, we've been able to secure some PPE through our supply chain, and then we've worked very closely with the Texas Association of Community Health Centers and Jose Camacho there, who's their CEO, who's just been tremendous in helping us secure additional resources. Now, that hasn't been the only things that have contributed to this. Actually, the biggest thing that's contributed our ability to go ahead and conserve PPE that it's allowing us to reopen these sites that were temporarily closed is actually the significant reduction of on-site services we're providing. And so Monica and Mr. Giesland and Ms. Crowley have indicated that we made this rapid switch over to telemedicine and telehealth. And the reality is the vast majority of what we're doing right now is phone only. There's very little going on computer to computer. It's just telephone. Patients don't have to have a smartphone. Both our patients and providers are providing very good feedback. They feel like the clinical interactions are good. They're productive. We're getting our patients what they need. So by way of example, we typically provide 2,000 visits a day on average in a non-coronavirus pandemic situation. We are right now hovering between 1,200 to 1,400 a day, of which 70% of them are being provided telephonically, which means at the local level in our clinics across the system, we're averaging about 350 to 400 visits on site. That in and of itself has reduced the consumption of personal protective equipment. Coupled to that, the governor ordered, and we were already there anyways based on the American Dental Association, but the governor ordered the stoppage, the postponement of all elective dental procedures. And in so doing, when we do dental cleanings, there's a lot of masks and gowns that are consumed that way. And so that freed up additional personal protective equipment. And so these were temporary sites closures that were out of necessity to conserve that. We got to a place now where we have sufficient PPE. There's no guarantee that we're going to be there for the indefinitely. We don't know what the future holds, but our commitment is to keep these sites going just like our other sites, so long as we have the adequate resources. And we think that things are stable right now for the next few weeks based on what we know to be able to reopen them, and hopefully beyond that, right? Our commitment is certainly to get the services where they need to be and should be, and that's what we're trying to do. And this is very purposeful because we know community care on average every year serves about 85% of the 130,000 unique lives that we have the privilege of caring for. 85% of those folks are drawn from communities of color. And our vision is to reduce health inequities within the community, level the playing field. And the way we do that is to make sure that our brothers and sisters who are Hispanic, African American, have access to the resources they need and deserve. The other thing is relative to opening sites. We did open yesterday. Our Hornsby Bend Health Center reopened. Early next week, we're looking to reopen our Del Valley Health Center, and our teams are putting plans together to reestablish 1 day a week in Colony Park for our mobile medical services, which is the RV medical unit that we have, targeting our homeless population or formerly homeless population housed at the Community First Village that will reopen, as well as our Round Rock Maze pediatric site is looking to come online in the next several weeks. All of this is predicated on our ability to continue to secure not only the tests that we need to test, but the personal protective equipment we need. I do want to recognize that our board members, as I mentioned earlier, executive committee members are on, and I'd like to give them an opportunity to provide their perspective if that's allowable.
Of course. Thank you so much for this update and for all that you are doing. And we would be delighted to hear from them.
Great. I'm going to stop sharing my screen and let them chime in.
Do we have someone who wants to speak at this time?
Hi, my name is Chris Rios. I would like to defer to our chairman, Dr. Tom Coopwood, if he's on the line. So I'm going to give him a minute to see if he can.
Sure.
And then
Dr. Coopwood, are you on the line? Dr. Coopwood? Maybe someone
well, not,
let's give our technology folks a minute to see if Dr. Coopwood's on the line.
Well, no, if not, I can speak. So Christopher Rios, current treasurer of the board for Community Care Health Centers, was past chairman for the past 4 years until Dr. Coopwood was able to take the reins this past January. You know, our board has been extremely engaged with Jason, and I can tell that you're always impressed with hearing that man and the level of leadership and knowledge he brings to the organization, such a valuable asset and leader. We've been highly engaged with him, especially as board and executive committee. We meet with him weekly, and he gives us all the basic updates of what's happening. We provide him with as much guidance as we can on the operational integrity of the organization, making sure that we are fulfilling our federal requirements as a board of directors, overseeing the operations of the health center system. You know, our top priority, I think as Jason has said, is we want to make sure we're doing everything we can to provide the highest, best services to our patients, continue that care, but most importantly, ensuring that our staff are protected. You know, that's one of our most precious resources are the men and women that choose to work for community care and go out and do the work that they do. Without them, we have no mission. So, you know, we're always thinking of the safety of the staff, and we're glad the staff has been able to come up with a plan to provide services in our smaller sites using the conservation methods that Jason's outlined. We're continually apprised of what's happening in the system. It's a fluid system. It's a fluid case, and I want to thank Central Health for allowing us to bill for telehealth visits. As you know, majority of our reimbursement for the services we provide are on an encounter basis. So allowing us to utilize telehealth to be flexible and adaptable to this current environment was extremely helpful for the organization. That's all I'll say for now, unless any of my other colleagues are on. But we just want to thank you for your continued support, and know that our staff is doing whatever they can to provide the information that's needed to ensure that we're serving the people that we're entitled to serve, and we're trying to help. One note that our staff has started weekly informational items. I saw a couple of you on some basically a teleconference where our staff is giving community information and offering the community an opportunity to ask questions. That'll be done every Tuesday and Thursday. And we really encourage all those attending to just listen in. We'll give you as clear of an update as we can periodically.
Thank you so much. I did listen in today, and we are deeply grateful for the work of all of you and for your board, and for all that you are doing to make sure that those in the community who need care are getting it, and of course to protect the health and safety of the front line, all of those healthcare providers. Thank you. Is there anyone else who wishes to speak?
Good evening, Chairperson Greenberg. This is Pilar Sanchez. I'm Vice Chair of the Community Care Board.
Pilar, I think you're muted.
I just wanted to commend the staff at Community Care. They're at the front lines serving the most vulnerable population at a really challenging time for all of us. They are quickly adapting to the situation as it changes, depending on the supplies of testing material and personal protective equipment, which continues to fluctuate. They have taken a very complex system and adapted as they go. So I just want to thank them for their service and for always keeping the community in mind and making them the priority.
Thank you. Thank you for your service, and we certainly echo everything that you have said. Thank you so much, and thank you to all of the caregivers. Anyone else? Dr. Fournier, does that conclude your discussion of sub-items B and C?
It does, just noting that our secretary, Guy Swenson, is having audio issues. He did add to the chat and indicated that he's hopeful that there's increase between both Central Health and community care, increased educational opportunities for those that we collectively serve. And so just relaying that message through the chat. But that concludes our report for this evening, Manager Greenberg.
Sure, indeed. Thank him for that comment. We appreciate it. So with that, we will move to sub-item D, which is communications and outreach efforts and resources, and Ted Burton will be presenting. Ted, you're muted. Ted? Ted?
Chair Greenberg, actually, I believe John Morgan and Sarita Clark Leach have some comments.
Let's proceed then with their comments. And that will be still under items B and C, is that correct? So we are returning to items B and C for the comments of John Morgan and Sarita Clark Leach. Please proceed.
Thank you, Chair Greenberg. Can you hear me okay?
Yes, sir.
Great. Thank you, and good evening, managers. I'm John Morgan, Chief Operating Officer for Central Health. As mentioned, I'm joined tonight by Sarita Clark Leach, and I'm going to make a few comments while Sarita, who's our Director of Analytics and Reporting, shares her screen. She's got a few slides for you. So tonight, in the context of Jason's report related to community care's screening and testing efforts, we wanted to share some initial insights into the COVID-19 data that's currently available in our community. As you've seen in both the local and national media, access to real-time or near real-time data is critical to understanding and getting ahead of a public health crisis like the one we're seeing today. That also includes our ability to strategically position screening and testing the way community care is doing now for our at-risk populations. As you likely know, most of the initial focus on COVID data collection was really related to critical hospital bed and equipment capacity, such as ventilators, as well as the numbers of patients that were testing positive and related hospital admissions for confirmed cases. As the public health response continues to evolve and include a focus on mass testing, on contact tracing, and on containment of the virus, we need more and more detailed data and refined data sets that specifically look at patient demographics and geography. To that end, you heard Jason talk a lot about their data. We're working very closely with Community Care to develop reports that we can share with the Board of Managers and the public based on their testing experience and their treatment of COVID patients, as well as pursuing additional data sets from the City of Austin and our local hospitals. We heard recently that we're expecting additional demographic analysis to come out from the City of Austin and Austin Public Health yet this week. I'd like to direct your attention to the screen or to the packet. I believe starting on page 11 is Sarita's presentation. I'll turn it over to her now to discuss a few of the highlights.
Great. Can everyone see my screen?
I can see it, Sarita.
Great. These data, as John indicated, were sourced from public health, Austin Public Health data that are available online publicly. And they're essentially a look to see which zip codes and areas are being specifically impacted by increases in counts and in rates of confirmed COVID cases. So looking at the top 5 largest increases in confirmed case counts, the zip codes that come into play are 78748, and that's the Burl Ranch Slaughter Creek neighborhood, and which saw a significant increase of 109%, and going from 34, count of 34 confirmed cases on the 8th to 71 confirmed cases. We see also an increase in 78741, going from 32 confirmed cases on the 8th to 63 on the 14th, representing an increase of 97%, followed by Duff Springs. And I won't go into detail and read those numbers to you, but Duff Springs, downtown Austin, and Pflugerville. A lot of these areas do align with the areas that Central Health has communications is targeting for outreach and communication, but there are some that do show increases, and maybe that we need to continue to monitor and focus on those neighborhoods as well. In addition to these populated neighborhoods, we do have a few others, St. John's and Colony Park, with, that showed large rates of increases as well. So again, it's not necessarily just where those numbers are large of confirmed cases within zip code, but we want to look at how much of that rate is increasing. And as with everything else, I want to caveat these data because we're in the early stages of this, with the fact that these numbers, increases in numbers, could be due to an increase in testing that would reveal more of, that confirms more of the cases rather than an increase in spread, if that makes sense.
Yes, that makes sense. Thank you.
Great. And these, again, are sourced from the APH data on the City of Austin website, and they do have a breakdown by race and by ethnicity. Unfortunately, we can't easily compare the rate of change in the race breakdown because of how they use 2 different calculation methodologies to get to the percentages when they did these. So we can focus on ethnicity for now, and we can see that insofar as the breakdown between non-Hispanic, Hispanic, there was an increase among the Hispanic population of about 6%, and a decrease in the non-Hispanic population of about 7%. And that's also something that we do need to keep an eye on because this rate is growing. From yesterday to what is currently published on today's site, and if you will, I'll share that for a sec. You'll see that we're currently at Hispanics are 40% of the proportion of the population who have been confirmed with COVID. So, and the other thing to note is that, sorry, I'm going to go back to my screen, is that a lot of the zip codes outlined, about actually 6 of those 7 zip codes outlined are also zip codes with a large Hispanic MAP or MAP basic enrollee population. So that is the information that I have to share today. Do we have any questions?
We're not
Thank you,
taking
Sarita.
questions at this time. We're going to wait until we go through all of our sub items.
Thank you.
Is there anything else that you would wish to share at this time, John?
Yes,
John
ma'am.
Morgan?
Yes, ma'am. So just for the board's awareness, also in your packet tonight, after Sarita's brief presentation, we've provided some updated information regarding MAP enrollment and applications for the MAP and MAP basic programs. I won't go into detail on that tonight, but at a high level, just know that we saw a fairly significant increase in volumes of applications in March that are beginning to level off. I'm certainly proud of both our analytics team as well as our eligibility team, who've completely changed their operating models while maintaining the services that they provide both to our patients and to our organization during this difficult time. As we're seeing these increased applications and trying to transition to a virtual eligibility environment, I'll just reinforce 2 changes that took place recently. One, as the board authorized Mike last month, we extended enrollment for folks that were whose coverage was going to expire between March 31st and March 15th and May 31st, adding an additional 90-day coverage period automatically to their enrollment. And then just this week, our eligibility team went live with an online application that helps our residents enroll without having to come into the office for a face-to-face process.
Thank you so much, John and Sarita, for your excellent presentation and for the amazing work you are doing. The way that you have been able to pivot and to provide these services in a new way, and whether it's eligibility or telephone health and all of these other aspects. Thank you so much for what you're doing. We deeply appreciate it. Is there anything else that we need to cover on items B and C? Pearl, is there anything else we need to cover on items B and C?
No, ma'am. I think now is the...
Okay, so then we will move to item D then, which is the communications and outreach efforts and resources. And Ted Burton will be presenting on that item.
Good evening.
Ted?
Can you hear me?
Yes, sir.
Can you hear me? Great. This is Ted Burton, Vice President of Communications at Central Health. This pandemic, like it has for our whole organization, has forced even more people to become digitally connected. This meeting is a prime example of that. However, our team understands that those who lack internet access are at risk at being left behind, and we cannot let that happen. We are closely working with community members, and we pivoted our community engagement and outreach strategies to reach patients, MAP basic members, people recently unemployed due to COVID-19, and of course, people living with low income, living in zip codes with a history of racial inequities. And these zip codes, for the most part, in our Eastern Travis County priority areas. Our Central Health Communications team is working extremely closely with Community Care's marketing team. And I just wanted to give a shout out to Monica Saavedra and Leonora Dominguez, who've been working with us daily. We're on every day, we have a morning huddle, and they participate along with Sendero, and of course, working closely with Matt Balthazar and Jason Fournier. Our integrated team is working really hard to make sure that we leave no stone unturned when it comes to reaching everybody in our community. I'd also like to point out that the Austin Travis County Emergency Operations Center has recognized Central Health for its ability to contact hard-to-reach populations, and they've called upon us to support their communications efforts. As an example, when the mayor first released guidelines regarding masking in public, officials were concerned that the message wouldn't reach residents, and our team, vulnerable residents, and our team was already talking about how that message needed to be crafted in a very culturally appropriate way. And so the EOC called on Central Health to assist. I also want to give a thank you to Megan Cermak, who's been an invaluable conduit to the EOC, along with, of course, our leader, Mike Giesland. Back to our communications effort, I think you'll see on your screen, if the magic button works, a copy of the dashboard that is in your backup board report. And I'll go into a little bit more detail, but I really can't go into all of it because we would be here for way too long. But the dashboard is really a bird's eye view of all of the communications, engagement, and outreach efforts going on behalf of Central Health and community care. Let's start with community conversations. Chris Rios mentioned that today, community care hosted a community conversation, virtual conversation. We hosted one together last week, and now community care will lead these bi-weekly, Tuesdays, Thursdays. The first half hour is in Spanish, English. The second half hour is in Spanish. Our community health workers, they were part of a pilot that the board approved beginning last summer, have been invaluable. They've made more than 600 calls to MAP and MAP basic members, talking about, and we've reached about half of them, but with COVID information, prevention information, how to get tested, and really importantly, how to use telehealth. So we're really grateful for our community health workers. We are preparing a direct mail piece where we're going to directly mail information to more than 60,000 families with low income and priority zip codes, primarily in East Travis County, using zip code information, some of which Sarita shared with you a few minutes ago. We're going to do 3 separate direct mail pieces in sequence. So first, covering general COVID coverage and protection information, a second mailer on how to get care and health coverage, and then finally a direct mail piece on screening and testing. So we are in the process of getting that ready to go out, hopefully the first of next week. Our team has compiled a list of social resources for several communities, specific to communities, including Manor Colony Park, Hornsey Bend, Del Valle, and Pflugerville, and we're sharing that information with residents and partners. All of this information is available on our website, and I would encourage you to go there, download, and share if you can. And of course, I want to keep hitting this. Everything we produce is produced in Spanish and English. And so whether it's media relations, social media, paid advertising, and outreach. We are about to begin a texting campaign. COVID-19 expedited the adoption of a texting platform that allows us to text up to 500 community members. Again, this was really strong advice from our community health workers about how to reach hard to reach populations. They prefer texting over email, and so we're going to be using that more and more. Our team has been conducting faith-based outreach. Jenna Allen has been leading this, reaching 12 faith-based centers so far, providing coronavirus information in English and Spanish, and asking them to share that with their congregants, and that outreach continues. We've posted information on 114 different Facebook groups, and we are calling individual members of our advisory committees and emailing them as well. And I want to say that our advisory committees have been, their input has been invaluable. And so we are really relying on them very closely for guidance and information about what we should communicate, how, and where. We've also been using paid media. So we've invested in paid online advertising, paid social media, and radio, primarily Spanish language radio and R&B stations to reach Spanish-speaking audience and African-American audiences. We plan to do more paid media, including print, advertising, specifically in minority publications. As a result of these advertising efforts, We've had more than 42,000 visits to our website. Can I repeat that? 42,000 visits. So people are going to our website for information.
That a third time.
And Mike McKinnon, I know he's listening, has been working day and night to keep our website updated with our entire team producing content. So we've had nearly 6,000 views of our videos, 171,000 Twitter impressions, and nearly 3,700 Facebook likes. And those numbers, by the way, are dated because they're a few days old, so I'm sure they're higher now. All in all, our paid online and social media messages have reached have been seen more than 1.3 million times. Speaking of social media, there is a toolkit on our website at centralhealth.net under partners. Please look at it and share the content if you can. Everything, again, is produced in English and Spanish. There's some really good, clear, simple, culturally appropriate graphics and messaging. And thanks to our social media team, it's the entire team, but led by Anastasia Mitchell, I should say Sims, because she got married recently. We've produced 104 social media posts, 14 videos, and we haven't even shared all the videos yet. So we have 6 more that we have not shared yet. And I am wrapping up with earned media. Of course, working with our media partners has been critical. And I just want to commend, as a former reporter, the local media has been incredible. They are working like you are around the clock to help educate the people that we serve. And I really appreciate that partnership. We've written and sent out approximately 12 press releases and media alerts in English and Spanish. And Central Health and Community Care have been mentioned 385 times as of yesterday in the media. And again, a special shout out to Jason Fournier and Mike Giesland, who've been conducting dozens of interviews in English. And then Ivan Davila and Monica Saavedra are amazing with the media, and they're doing interviews on Univision and other places. I know I'm a pest because I text Mike or Jason or and say, hey, we have a reporter that wants to talk and their deadline is in 5 minutes. And they've never yet turned me down. So I'm really appreciative of that. Finally, I hope that you're all receiving our In the News updates with the latest information about our enterprise and of course, relevant news about COVID-19. So those go out daily. And with the help of IT, they've been incredible. And Mike McKinnon, we launched an employee intranet as the COVID-19 situation got more serious and more of our employees were working from home. And so that intranet is like an internal Facebook for our employees to stay connected and to stay current on everything that we're doing. And that's all I have.
Okay. Thank you so much. We are very appreciative of everything that you and your team and those folks at Community Care and at the Emergency Operations Center and all who you are collaborating with. This is just a tremendous effort, and the outreach that you have described and the amount of contact is beyond what I could have envisioned or expected. So thank you. Thank you so much to everyone who has been helping with this endeavor. I'm sure I don't know them all and couldn't name them all. So thank you to everyone. That concludes item D, which was communications and outreach efforts and resources. So at this time, and thank you board members for your patience. As I said, with the technology, I thought it would be best to go through all of the presentations and then open up to questions. So questions at this time, Manju Musaitif.
Thank you, Chair. I appreciate it. First of all, I want to thank our staff, our CEO, for all their efforts. In addition, I also want to thank our community for their perseverance and persistence in bringing their voice to the table. I really appreciate them for reaching out to me and reaching out to our staff and for really addressing their concerns, because it takes a village to do the work we are doing. I'm really thankful for them. I know, as you all know beforehand, my philosophy is really addressing the health needs beyond the clinical walls and bridging public health with healthcare. And we can no longer continue the way we operate and no longer be in a position just to be reactive. And we need to be proactive and putting health equity, the heart and center of everything that we do, which we are, but we can do better and expand on that work. And I know we don't know when COVID-19 will disappear. It's going to hang around with us for the long period of time. And situations, it's going to change the way how we operate and we do business in our lives right now. Several comments that actually recommendations that I presented to our CEO, which I think they really addressed them in a timely manner, and especially with the voice of the community members. I really highly appreciate it. And thanks for all the work that that you're doing. In addition to that, there are several concerns of mine. First of all, in terms of testing, how many are really available? And I know the data that has been published from the city of Austin, I just find it perhaps a little bit more biased. It's tailored to their population, but not specifically to ours. And understanding the burden of disease on our population and knowing African Americans, people of color, are disproportionately impacted by COVID-19. And I wanted us to have a more of an aggressive approach in how we are testing and the messaging we are also sending out to our community in terms of how can you be tested and where are the testing located. There's a lot of confusion of who's testing. Is it Austin Public Health? Is it us? I think we need to make that very clear. And also, and then in addition to something else, I know the mayor and including the city, the county judge, required all of us to wear masks. And I would ask to see what are we doing in terms of providing our patients with masks? Are we? And I know this has been a barrier to several community members, a lack of access to these masks. So I would hope that we can address it. I will leave further comments to our board members and later on address it. But these are. And I look forward to an engaging discussion. Thank you.
Thank you so much. And thank you to all those in the community who have been so helpful to us with suggestions and contacting us and even helping with location. So we are very grateful to all in the community, and we appreciate that immensely. And we will continue to be there for you and to listen to you. And we appreciate all of your wisdom. Was there anything, Mr. Giesland, that you wanted to address?
Thank you, Madam Chair. No, not specifically, but just overall, Manager Musada, we really appreciate your comments. And I think in terms of testing, in terms of being more aggressive, I mean, what Jason laid out in terms of community care's approach to this is probably one of the most aggressive approaches to push out into the underserved and in many cases forgotten areas of Eastern Travis County. And so we'll continue to support community care in this endeavor, and in particularly in the outreach side of it. As Ted laid out, we have a very effective communications and outreach machine. And so that's, obviously at community care's disposal. And so we're going to continue to work on that. I'm not advised in terms of masks for patients, although I do know that we have put out some media around masks and wearing masks, and have pushed out information and reposted it in terms of where to go to, for the homemade portion of the homemade style of mask. Right. But I'm not advised about any commercially produced masks for patients.
In fact, I think Manager Jones, weren't you involved in some video on regarding masks and using and making masks?
No, I wasn't involved in that. I did recommend to CEO Giesland that an agency that was willing to collaborate and work with them doing that. But
Thank you, Ben. Thank you for that help. I knew that you had been involved in some way in helping us with that, and I appreciate it. Board members, other questions or?
Yeah, I have a couple of questions and comments. I guess my question format for tonight. So on this item, I have just a few comments. I'll make them quickly.
Thank you.
First of all, I'd like to join with my other board colleagues in thanking Central Health and Community Care and our partners for a fantastic job. I mean, this is an event like none other in our lifetime, and you're to be commended given the challenges we face in this city, in this county, and in this state and nation. I'd like to find out a couple of comments on some questions with me. First of all, with regards to our role with the EOC. Now, I want to make sure I'm clear. Are we the representative at EOC, or is it Community Care, or are we jointly represented?
We are both. I'll let Mr. Giesling answer that too, but we are represented. Central Health is represented by Mr. Giesling and Megan Cermak, who's reporting directly up to him, and Central Health is Community Care is represented by Jason Fournier and also the physicians, but I'll let them reply to that also.
Yes, and so I'll speak to that in two parts. I'll speak to the Emergency Operations Center as a formal structure, and then the regular calls that we have with other healthcare leaders throughout the week. And I'll ask for Megan and Jason to please chime in and correct me if I've misstate or miss any pertinent information that the board might need or want. With respect to the Emergency Operations Center, this is a joint city and county and local government agency response effort that is part of all localities have these types of operations, and they're more sophisticated with urban areas. But we have a seat within the EOC, which is now operating virtually. Usually it is a desk seat. And Community Care has taken that seat simply just as an information conduit. They're not deciding things for Central Health. That decision authority still rests with the board or the CEO. Now, if there is a decision to be made that involves management and it's within our scope of authority, obviously that gets routed to us to make that decision. So, for example, contributing staff to help with contact tracing, that's a decision that's routed to us. Now, the question, well, why not both sit there? After our experience with Harvey, we felt like that there was a delay in much needed information related to medical operations, that it would have worked a lot better had Community Care been at that seat and us working together. And so we flipped it this time, and it's absolutely the right decision. I think it's worked well. We have real-time updates and as well as regular team meetings where our respective executive teams come together. Now that's on the EOC. With respect to the regional calls, and I'm participating in those calls, and so is Jason. I know there's others that are monitoring those calls as well. And at these regional calls, it's hospitals, the Emergency Operations Center, the Capital Area Trauma Regional Advisory Council. The mayor and the judge are also on these calls, and I'm probably missing some other participants, Austin Public Health. But in these regional calls, they surface issues related to healthcare and healthcare operations and logistics and mass casualties. And through these calls, we're able to advocate for primary care or additional testing resources or additional PPE, but also additional data sets, specifically demographic data that explains what is happening by race and ethnicity and gender and other demographic attributes within the population. And so these are fairly broad-ranging calls that occur. They were occurring daily. Now they've been set 3 days a week with notice that we could be on call at any time. And Jason and I participate in those calls. As Manager Greenberg said, we have a seat on that call and we actively participate.
Okay, Mike, you've answered the question. I really appreciate it. I mean, I've been on, excuse me, through SARS, H1N1, several. I've been in that role, so I certainly understand what you're talking about. But when the comments were made that Community Care is there as our representative, or is there, I want to make sure that they're there either as a partner or as a representative, but not speaking on behalf of Central Health, particularly to the level we have.
Yes, sir. That's correct. They are there. You know, we are working together as an enterprise. And in my conversations with Director Hayden early on in this process, you know, I conveyed, look, while community care may be there at the desk, and now it's a virtual desk, if you talk to one, it's the same as speaking to both of us. However, if there are any decisions that are specific to Central Health, and we're making those decisions if we're authorized to do it at the management level. If not, we bump it up to the board level. I did forget to mention that, Megan, you could inform on this, that we are rotating in on monitoring those regular EOC calls. Mm-hmm. Is that correct still?
Yes, there's twice daily briefings from the EOC that we take note for community care for.
Okay. So we are rotating in and out to allow the community care staff an opportunity to focus on other work.
Well, okay. Well, I just want to make sure that we're all on the same page, because yes, I have all the respect for community care, and they've done a fantastic job, exceptional job. But when we speak for Central Health, I want the Emergency Operations Center to know that we're speaking on behalf of the enterprise, which we're the head of. The second point I was heading to relates quickly to, I think, something that Jason made. I think is an excellent point. COVID-19 is an excellent opportunity for us to accelerate our efforts in Eastern Travis County. I think that the opportunity we have now with as we look at new strategic planning we might want to do, any additional federal or state funding we might get as a result of this, we need to look at how do we build up our capacity in that part of the county. Because what we're going to see as the wave of COVID-19 continues hits our county will be some significant numbers in that area. And our ability to have facilities out there to be proactive will go a long ways towards not only this event, but future events in the future. The next item I would say is, I do agree, back to your comments earlier, Chair. Yes, I did a video on several items we were talking about, and masking was one of them, was the use of masks. And so I didn't quite understand your question. So yes, I did something.
And I appreciate you doing that. Thank you so much.
Okay, just three more quick questions. One is the time for opening the Pflugerville will need to be relatively soon, I think, because I didn't quite understand that. I don't know if Jason can speak to that. Are we saying we don't have a time for the opening up of that location for testing, or we do, or we're still looking at it? And does he have a time frame, if not an exact date?
Jason, would you mind addressing that? You're on mute. There you go.
Yeah, absolutely. So we've got 3 confirmations right now for the sites. The times are going to be consistently, so for Austin's Colony, Hornsby Bend, we're targeting each week on Tuesdays, and the team will set up from 8 to 9. Testing will proceed from 9 till 4, and then kind of ramp down. Manor is going to be on Wednesday, same time frame. Dove Springs, similarly at the William Cannon site, and that's on Mondays. Del Valley Southeast Metropolitan Park would be on Thursdays, 9 to 4 effectively, and then Colony Park at Barbara Jordan Middle School will start tomorrow, actually, Manager Jones, and we'll be out there tomorrow testing from 9 to 4 effectively again.
Okay, but you didn't have a Pflugerville date, is that correct?
Well, we're working on a plan relative to that, yes. And we're hopeful to have something solidified by early next week to mid next week at the latest. Right now, it's just juggling our teams. And I actually, just so you have awareness, I did authorize our teams to go out and get additional contracted employees to be able to help with that if need be that nursing staff and others, because we've got, just so you have some awareness, we have 63 of our staff members out right now, not due to coronavirus directly, but indirectly, yes. And so, we're struggling with workforce issues like other healthcare providers. The majority are out because of childcare issues and or because they're caring for someone else who has illness.
Well, I understand, and I commend you on your efforts to fill in those gaps and address it. I just because if you look at the numbers that were presented earlier, particularly for the increase in Pflugerville, that's going to be a hot spot. And my last question, Chair Carson, is to talk about the racial data. And I think Sarita was speaking to the racial data she was not, I don't say comfortable, I think she wasn't sure if that is reflective. Can you speak a little bit to that, Sharita, again?
Sure. It was a calculation methodology that they used to come up with the proportions relative to race. I could go and backward calculate their numbers, but I really do need to touch base with APH before I do that. When they first calculated, the first time they published these numbers on the 8th, they included Hispanics in the total denominator to calculate the proportion of race. So when you look at the table of the race breakdown, you'll notice that it doesn't quite total 100%. It totaled about 67% because at that time, 33% of the population was Hispanic. And then when they did it more recently, they excluded the Hispanic population from the total to calculate, and that's why you see that the different races become higher percentages than they were. So it's not quite an apples to apples comparison. I went back and did the math, and the numbers don't add up quite right either. So there's a little fudging as statisticians can do sometimes. But
as we say, the numbers don't quite fit. But Manager Jones, I do want you to know that we have asked that we receive this information by race and ethnicity in a standard format, and that should be happening very soon. Is that correct, Mr. Giesland?
Yes, it is.
All right, thank you.
And thanks very much. That was my last question. Thank you,
thank
Sarita,
you.
because you did speak particularly to what I thought was probably the factor. And once again, thank all of you. You all for doing a fantastic job during these very, very trying times.
Other questions? Manager Oliver, did you have your hand up before? Manager Oliver?
Thank you. And I want to reiterate what all the other managers and I think management of Central Health has said, and thank you to everybody who is working tirelessly through this. This is unprecedented, and thank you. Thank you. And Jason, I hope you share with the healthcare workers of community care how much the Board of Managers values what they do. And we know that PP has been scarce at times, and they're still doing the job of showing up and taking care of folks. So thank you. Ted, I just wanted to comment. Thank you for sending direct mail. I think a couple years ago when I first got on this board, I think I mentioned, like, can we do direct mail pieces? Because not everybody has internet. Thank you. And I'm not going to speak for Manager Valadez, but I think she would say thank you for doing it in Spanish and English. Not sure. Yep, I saw a clap. Also, I know y'all are doing texts. Do y'all need volunteers at all? And, you know, that could be a call to action for any of the folks who are watching, and just a call to action for text messaging or phone calls to folks just to let them know what's available. And you're on
This
mute.
is Ted. Are you,
Ted, do you want to respond to that?
Can you hear
please?
me?
Yeah.
Yes.
Do we need volunteers to help send the text out, or volunteers just to help in general? I didn't understand the question.
How about either? Yeah, either.
So the texting is we don't need it for the texting because it's a platform. So it's a platform that we use so we can write the text and send it out to the group that we're trying to reach. And then in terms of volunteers, I can't answer the question right away. We do have our community health champions that we always turn to and are willing to help us, and our advisory committees. I want to say again, there are some members of the community, along with some elected officials, that have been invaluable as we try to reach communities. So I don't have an answer for you about volunteers, but we will get back to you. Is that okay?
Totally fine. I just thought, you know, in this time of sheltering in place, I know people are looking for ways to be helpful. And if there's a place to slot people in, that might be a good way to do it. I also just
I like the idea. Thank you.
You're welcome. I also want to say, I know there's a team of people behind Mike McKinnon, but thank you, Mike McKinnon, for your emails, because I scour them, as I'm sure everybody else on this call does, and they're so informative, so thank you. I just wanted to throw one thing. Is there a way to get added to an email list if somebody is not on the email distribution for Mike McKinnon? I don't know if those go out widely to the community.
Yeah, I'm here.
Absolutely. So, sorry. Mike's here. Yeah. Go ahead, Mike.
Oh, I was just going to say, yes, absolutely. We're the joint tech, our IT department actually handles those lists, but we can add people within the organization or even externally, because I know we have some of our community care board members who we just added to that list. So yes, just if you want to get the names to me or through Ted or however, we're happy to accommodate.
I was thinking more in the terms of, is there a link where somebody can say, yeah, we're going to send us for email updates?
There is a link.
Yes.
Well, there's a link for email updates from Central Health. We haven't done a link for the in the news updates, but we could. And just as a reminder, that is a new platform as well that we began in January, which allows us to collect more media and social media conversations and share that with you. So that's been a huge help, and Mike has been spearheading that as our technology guru.
I also want to mention that we do have a form, an online forum for people to get updates around COVID-19 and our response to COVID-19 that Mike McKinnon has set up and that we've been sharing with stakeholders and everyone.
And Yvonne, where might they go to find that?
On our website, centralhealth.net/COVID-19.
Thank you. So, and then just two final things. One, I concur with Manager Jones. So the federal resources that we might get, I know that we've got to be diligent in where we are allocating them, because we aren't going to have, it's not business as usual. And I imagine that even the limited amount of resources that we have, and that, you know, I know community care said that they have seen a drop off in normal patient business. But I would concur, as much as we can, allocate a majority to the Eastern Crescent so that we can mitigate the damage and devastation that this virus will eventually do. And then one final, so it's just a comment. My final thing, it's a question for Jason with respect to testing. And I know Moran brought up a great question about testing. We want to make sure that we have them availability. But I know we've done better in testing. Are there any issues right now, because we're reading about reagents and being able to test the backlog, or I guess there's a backlog of tests. The tests are there, but we aren't able to necessarily perform the test because the reagent isn't there. Is that an issue? And then I'm done.
Jason, do you want to answer that, please?
Yeah, happy to. So Manager Oliver, yes, we're hearing from our reference labs that there are shortages on reagents, but we have not seen any direct impact that is extended our processing time. Again, it's between 24 hours to 5 days right now, and it's just variable depending on how many tests are coming through in the lab. One of the things that we have done, working with our association here for community health centers in Texas, so we secured some additional tests through another lab vendor, which on Monday we got 200 and then an additional 50 every day. So every little bit is just allowing us to do that much more within the community. And then Austin Public Health Department's also committed tests, but the reagents are a real issue. Last week there wasn't enough media to obtain the test. This week the word seems to be it's reagents. I think we're just struggling not only locally, nationally, but globally in terms of just the needed supplies to effectively test and respond to coronavirus.
Thank you very much. Other questions, managers? Manager Valadez. You need to unmute.
Now?
Yes.
Okay. Thank you all very much, everybody, for the work that they're doing, the great work that they're doing, all our staff, all the volunteers, every person at the table and not at the table. First of all, with respect to the EOC group, is that basically, I know you said Travis County is in there, but is that basically City of Austin data that they're reporting? Because I haven't noticed any county or outlying areas or zip codes included? Just real quickly, if somebody can tell me that.
Sarita or Megan?
Hospitalization.
So,
Go ahead, Sarita.
so the data that I presented earlier did have zip code information, and it is sourced from Austin Public Health, and they are looking at Travis County in addition to the Austin MSA. So the area expands beyond Travis County as well. We do have the breakdowns by of confirmed cases by zip code.
Okay, thank you, because I was going to just make a comment. If I'm not mistaken in reading the data, it's about 40% Latino that has tested positive. Is that correct?
That is correct. 40% of the confirmed cases are identified as Hispanic.
Okay, so if we actually put the numbers to it, that's a pretty significant amount. And what I'd like to know is, and ask, whether or not we can stop focusing on one particular group and instead look at it from the perspective of populations of color and ethnicity or language, because I've noticed that I haven't seen anything with respect to language, and I don't know specifically how that demographic is being impacted. I know the community members that I speak to that are advocates for or within the non-English speaking community have great problems and are having difficulty in overcoming a lot of barriers. So since we know we have almost at least 175 to 200,000 uninsured in Travis County, and I'm still not quite sure how we're reaching those. I know in the outlying areas, especially those that may not necessarily be part of the digital community, but they do texting. If we have strategies in place to specifically target that population.
I believe we do. Ted, do you want to speak to that? Ted Burton, please.
I'm back.
I
guess I want to ask you specifically, as I mentioned in the presentation, everything that we're producing is in English and Spanish. And for people who aren't on the internet, who aren't connected, as I mentioned, we're doing direct mail pieces. We're calling people directly. We've started a texting campaign, and then just all of the social media and paid media that we're using to reach as well. But I can go back to the presentation if you'd like, or if there's a specific question, I'd be happy to answer it.
I'll get back with you on that. But with respect to it's a matter of gathering the data so that demographic is included, and that we have that. So you may have the Latino population or Hispanic, which I hate the term, and then of that, English or non-English speaking, so that we can better strategize or implement better implement a targeted campaign for those population residents in Travis County. That's all. I'll just my observation and comment on that.
Mr. Giesler, did you want to speak to that?
Well, I'll defer to Manager Valdez, and then I have just a brief comment on language.
Okay, thank you. Manager Valdez?
Do you want me to continue?
Yes,
Okay.
sorry, it's a little difficult with the technology. Yes, please continue.
Yeah. And so another observation, I noticed that there were about 600 people that were called, if I'm not mistaken, on by our staff. Would it be possible for anybody to consider, or this? Do we have Sendero community health workers or Sendero staff that's involved in the phone calling at all? I'm just curious. Is it just community health? Community care, or is it central health staff that's making phone calls?
This is Ted at Central Health and Community Care, and Sendero has been doing their own outreach. However, they are part of our daily huddles, so we're all collaborating on communication and community engagement.
Okay, it's just like, if we've got, it appears as if there's sometimes a staff situation, limitations, because everybody's pulling in double duties or triple duties or quadruple duties. And I wanted to know whether or not this would be an opportunity for us to bring in Sendero and bring in their staff, because I know their staff has been very, very good with respect to CHAP and with respect to pushing Sendero in the Spanish-speaking community.
Yeah,
So
and Cynthia, I don't have the press release in front.
that.
Yes, I don't have the information in front of me, but Sendero also made hundreds of phone calls to their high-risk patients,
Yes.
including members of CHAP. I don't have the exact number in front of me, but that began almost immediately.
Right.
So let me make a recommendation, if I could. Maybe if there are specific data requests at that level that that you could make them, and then Mr. Burton could get them out to everyone.
I appreciate that. And with respect to the phone calling and the texting that's occurring, is there a way for us to access, like they do political campaigns? This is a campaign, okay? So with respect to us purchasing lists or getting access to information, if we know that there are so many people that have been impacted in specific zip codes, is there a way for just to do mass texting in those neighborhoods that may or may not be part of Central Health, part of Sendero, part of community care, and just do it for those neighborhoods? That's what another question.
Mr. Burton, I think you mentioned a new texting platform.
Correct. And yes, and so I think the current platform that we have allows us to text 500 people at a time. In addition, Austin Public Health is also sending out our calls and texts. So everybody on this call probably got their call and text last Friday. So we're trying to complement what they're doing, not trying to overshadow what they're doing. But we can talk more about the texting initiative as well.
Other questions, members?
The Central to Community Care, whether or not they're also tracking those that may have flu-like symptoms or COVID-like symptoms as part of what is being considered when we look at receiving calls or tracking. Even though it may not necessarily be COVID unless you've gone through a test, but with respect to those flu-like symptoms and in what areas, so that we could target, if we know that they're clustered in a certain specific areas, can we hit them, with phone calls and texts and things like that, direct mails.
Thank you, Manager Valdez.
Chairperson, I just have one just quick caveat. As we talk about data that's being collected, we're at the very beginning of this.
That's right.
What data is ever reflected is not going to necessarily tell us what's going on in the entire county. So let's not extrapolate just from what we're preliminarily seeing that this is what it's going to look like over time. And I think Sarita was talking about that. So I think
let me add, a lot of that has to do with the availability of testing kits.
No, I agree.
The testing kits are limited all over the globe, and in the United States and in Texas, we have been very low in our testing per capita. So
I know.
I understand what you're saying, and we will have to see how the data evolves.
One last thing.
We have to make sure that we don't make decisions based upon this preliminary too soon, is my point.
I understand completely. One last thing, Manager Valadez, and then we'll move to Manager Musaitis.
It's going to be with respect to the financial implications and impacts on both Central Health and Community Care's budget. When are we going to be waiting until next week to address that?
Yes, as I said in my opening remarks.
I heard you say that.
Yes.
I thought I heard you say that. I was just having problems.
Sure. As I said in my opening remarks, we will be waiting till our regular board meeting next week to address that, because we want to make sure that our staff has the time to gather all the data that they need as far as the fiscal repercussions. Members, are there other questions? Manager Musaitis?
Thank you, Chair. My question really goes to more Jason. So he, in his slide that he presented, he said community care screened 1,000, almost 1,500 patients, and tested roughly around 1,000 patients. So my question is, for those who were tested, how many were contacted in terms of contact tracing, and that's the only way we can really contain this element of this infection. And another question really beforehand, what is the time lag for you to get the results once an individual is tested? Thank you.
Jason, I know that some of that has varied. Could you address that for us?
Yes, can you hear me?
Yes, sir.
Terrific. Yeah. So regarding Manager Yustef's first question in terms of contact tracing, so the way that it's working right now, when we receive a positive result back, we immediately notify APH. It's a report coronavirus infection is a reportable disease, and APH is actually responsible for contact tracing. Now, with that stated, earlier today, Community Care actually executed an agreement with Austin Public Health Department to function on its behalf as a delegated contact tracing entity. And so we're going to work hand in glove with Austin Public Health. We're actually also working with University of Texas Health Austin Dell Medical School on contact tracing, and 10 to 12 staff from Central Health and direct employees coupled with our employees are going to be responsible for tracing not only our own patients, but also going ahead and tracing community members as well. And we agree wholeheartedly that what's key for us in mitigating and containing coronavirus, first the testing, secondarily, and as important, is getting to go ahead and do contact tracing, and then instructing folks who have potentially been exposed to them, for them to get tested, but also to isolate. So we put that into play. I think as it relates to the second question on delays with testing, it's just variable depending. We're going through 3 different reference labs. So one day we can get something back within 24 to 48 hours. The next day it could be 4 or 5 days. We have a goal of reaching out to any patient for which we received a positive test in 24 hours or less. We have that going through our care coordination teams and immediately spending time, and we do education on the phone with them about next steps, how we're going to follow up with them, what to do if their symptoms have worsened, and really trying to partner with our patients to make sure that they understand, A, the disease process that they're experiencing, B, that we're still available to serve them, C, if we need to see them in one of our clinics, we'll certainly do so. And if their disease, COVID-19, has progressed, we'll actually have them attend to the hospital. And if EMS needs to be notified and brought in, that happens as well.
Thank you, Jason. Are there other members who have questions at this time?
Jerry, you're muted again.
Okay. I'm not seeing, sorry. I'm not seeing other members with questions at this time. So if there are no other questions, then I will move on to item number 2 on our agenda. Okay. If there are no other questions at this time, then I'll move on to item number 2 on our agenda, which is to confirm the next regular board meeting date, time, and location. Managers, our next regularly scheduled Central Health Board of Managers meeting will be held on Wednesday, April 22nd, 2020 at 5:30 p.m. remotely by toll-free video conference and/or telephone. In addition, I want to let everyone know that my plan is to convene a weekly meeting of the Board of Managers hereafter to discuss Central Health's responses to the COVID-19 pandemic. These meetings will cover the types of information we discussed this evening, as well as additional fiscal information. My expectation is that these weekly meetings will continue until we have reached a more stable operational state. Please understand that the backup information to be discussed at these special weekly meetings is unlikely to be available until immediately preceding the board meeting, and that's because the situation is constantly evolving and information prepared too far in advance of the meeting date would not be pertinent any longer. At this time, I'm ready to accept a motion for adjournment. Do I hear one?
I move.
Manager
I
Oliver
second.
moves adjournment. Was
I
that
second.
Manager Musaitif? Moves, a seconds that motion. All in favor signal by aye. Thumbs up, aye. Opposed? Any opposed? Any abstaining? Members, I want to say thank you so much for your dedication. I want to thank everyone who was on this, attended this meeting. I want to thank all of the staff of Central Health, of Community Care, of the city, of the county, of Dell Medical School, all of our community members who have been so helpful to us, and of course, all of those people who are working on the front lines, whether they are providing medical care, whether they are stocking our grocery shelves, or doing so many other things that are of importance to us in our daily lives. We will come through this, and thank you to everyone. Good night. Have a wonderful rest of your evening. Thank you.
Members.
Good night.
Good night.
Thank you. Bye, y'all.
Thank you.
Good night.